I'd like to call the Finance, Ways and Means Committee to order for October the 30th, 2025. Madam Clerk, please take the roll.
Representatives Baum.
Here.
Boyd.
Here.
Camper. Capley. Chisholm. Cochran. Crawford.
Present.
Faison.
Here.
Freeman. Gant.
Here.
Garrett.
Here.
Gillespie.
Here.
Grills.
Here.
Hale.
Here.
Hawk. Hicks of Washington.
Here.
Halsey.
Here.
Lamberth. Love. Miller. Moody.
Here.
Parkinson. Reeves.
Here.
Shaw.
Here.
Sparks. Vaughn.
Shout.
Williams.
Present.
Zachary.
Here.
Chairman Hicks.
Here.
You have a quorum.
All right, thank you very much. Members, are there any personal orders before we begin this morning? Hearing none and seeing none, I would like to remind the members, please be sure to sign in. And that way we can make sure that when you do want to be recognized, it's just a little bit easier to find you on the screen up here for your microphone. All right. Also, want to remind everyone that the presentation is on the dashboard regarding the presentation documents. And without further ado, without any objection, we are going to go out of session. We are out of session, and I'd like to welcome up Director Stephen Smith from TennCare and his team. Good morning to you. And if you would, as you begin, please just identify yourself and as well as your team, and you are ready to go. And just a reminder, Director, we will control the microphones up here. So once you, if you just be recognized, and then we'll turn your microphone on. That way you don't have to worry about that. So thank you all. Good morning. Thank you for being here.
All right. Thank you very much, Mr. Chairman, members. Good morning to you all. It's great to be with you all again. My name is Stephen Smith. I serve as the TennCare Director. To my right is Zane Seals, our Chief Financial Officer. And to my left, we have Kim Hagan, our Director of Member Services, and Dr. Victor Wu, our Chief Medical Officer. And we have some others in the audience as well. As this committee well knows, our state has a very long and complex history when it comes to Medicaid. It is one that is filled with tremendous challenges, but also notable achievements as we have strived to meet our mission of improving lives through high quality, cost-effective care. The fact is, and I talked about this earlier this year with you all, that TennCare is more successful today than at any point in its 30-year history. It really is a remarkable turnaround story. It's one that required a lot of difficult work and perseverance from many people and leaders over multiple decades, none more important than this committee and the General Assembly. Those efforts took us from a place where the TennCare budget was set to take every available new state revenue dollar to one where we now have record investments in TennCare. At the same time, we have record investments in public education and so many other priorities within state government. And that is not a coincidence. It's why we take so seriously this idea that TennCare is about so much more than just the TennCare program. The success of a state depends upon the success of its Medicaid program. And all you have to do is look across the country right now to see evidence of that fact. This hearing, of course, is focused on activity and performance since FY20. And we're proud to note that we've only gotten stronger during this time, despite the highly unusual and unpredictable events that have impacted us all. As you can see, trend rates continue to improve, as do investments in quality. No one could have reasonably predicted that back in 2020. Perhaps there is no greater evidence or confirmation of our program's success than our most recent innovation known as TennCare 3, which all started as a bold idea and concept from the General Assembly. I'll always take pride in the fact that we didn't just take your directive back in 2019 and just go through the motions with this idea that this is crazy, this will never get approved, the feds will never approve it, and so we'll just submit something and be done with it. Instead, with the governor's leadership and full support, we gave this 100%, and we landed a deal that had never been achieved or even attempted and to this day has not been replicated. It is a shared savings model that rewards Tennessee for its conservative, effective, and responsible management of its Medicaid program. We were absolutely confident in the deal that we structured, as we told you all back in 2021. But I'd be lying if I said that we thought we would achieve this level of success in such a short period of time. Since the inception of this waiver, we have had the largest TennCare investments than any other point in TennCare's history. And you can see the highlights on the screen there. These are not just numbers. I know there's a lot of numbers here. They're not just numbers. These are real lives, real people, real futures. There are stories behind every one of these investments, and I hope we're going to get a chance to tell those stories over the course of the next year. But by any definition, TennCare 3 is an unparalleled success. In just the 3 years of this 10-year waiver, we've achieved nearly $1 billion in shared savings that we can then reinvest back into the program in ways to benefit the people that we serve. And that's exactly what we are doing in partnership with the General Assembly. The most important thing that I can say to you all this morning is thank you. Thank you for pushing us, and thank you for taking a risk with us. I know there were a lot of people that were telling you all back in 2021 to reject this proposal. You had the confidence in us to get this right. And I think it has paid dividends for the people that we all serve. And you have our commitment that we'll continue to do everything that we can to continue getting this right. I want to stress that the success and the stability that we have today in our TennCare program, it's not normal. It is a very difficult time in Medicaid throughout the country. Across the nation, states have cut provider payments and services or are considering doing so. Some across the board cuts as high as 10%. We don't anticipate that happening here. And why is that? It's because we have been responsible and we've been reasonable. One of the most important things that we all did together, and you ultimately approved this, is during the pandemic, when we were receiving the enhanced federal matching dollars, we separated the anticipated non-recurring costs, and then we used those enhanced federal matching dollars to pay for those costs. At the same time, we continued to come forward and ask you all for the typical cost increases that we expected for what we believed would be our normal population once we were through the pandemic. Many states didn't do that, and they are now facing the consequences of that. Because we were able to fund all of our non-recurring expenses. We were able to make large reversions to the general fund at a time when that was desperately needed. We met our long-term obligations, and then we came out of the pandemic without a large gap to fill. That takes really good forecasting and planning, but it takes strong leadership and control from the funding body in this committee. So I want to thank you all for that. I want to highlight our enrollment since 2020 because it represents what I just talked about in terms of the importance of planning and forecasting and budgeting. What you'll see here is a sharp increase in our enrollment while the pause was in place, the federal pause and redeterminations. So we went from about 1.4 million to 1.8 million, which is a massive increase. And then you'll see a gradual decline once the pause was lifted to the point where we are today, where we're actually below where we were prior to the pandemic. But the point I want to make here is, as you can see, we never had to pause our renewals once that redetermination process started again. We were one of only a handful of states that at no point in time had to submit a mitigation plan to the federal government or pause our renewals. And to put that in perspective, if we had to pause for several months, really just a few months, as many states throughout the country had to do, that would have been an additional cost to the state of hundreds of millions of dollars. That's hundreds of millions that not available to do many of the things that you did in recent budgets, whether that's TCRS stability, OPEB liability, law enforcement communications, violent crime intervention grants, capital projects, and so many other things. So it just kind of goes back to that point that I made that TennCare is about much more than just TennCare. I recognize I'm over time. I suspect we'll get into some of the federal actions and impact when we get to Q&A. But I'll just close here. I want to acknowledge that despite the accomplishments that I noted, we know and understand that we have to continue to improve. That's not an option for us. Medicaid it's difficult. Our challenges are not going to get any easier. But I do know this, we are up for the challenge, and I remain confident that we can tackle them together with great success. So I'll stop there, Mr. Chairman. Happy to answer any questions or listen to your comments.
Director, thank you. Thank you for your presentation. We do have several folks on the list that have some questions and would like to have some comments. So we're going to begin with Chairman Williams. Chairman Williams, you're recognized, sir.
Thank you, Chairman. Thank you, Director Smith, for being here today. Obviously, great things going on at TennCare. Obviously, there's always rooms for improvement. I wanted to talk a little bit about shared savings. Obviously, over the last 3 years, you referenced in your presentation about approximately $1 billion in shared savings that this has been a topic of great discussion between you and I and Chairman Hicks and our counterparts in the Senate regarding those dollars going forward. I think they're approximately $980 million. I guess the question that I have for you is that, you know, those monies, is there a period of time, for instance, are the dollars that were savings in the first year, do they carry every year? And is there a deadline of which those shared savings can be redeployed?
Thank you for the question. Yeah, it's when you really stop and think about it, it's a staggering amount of money. And what we've tried to do is, because it's such a large amount, we've tried to spread those dollars out over multiple years. So that's what you've seen with the year one, the strong families, and then year two is rural health and behavioral health, and year three is long-term care primarily. And then you all made some decisions with some of the other funds. The answer to your question is the way this ultimately works is we have a lot of flexibility with those dollars. We made a commitment that we would use the dollars to benefit the people that we serve, the health and well-being of the people that we serve. But once we acquire those dollars, we have the ability. It's not like we don't have to spend them within 1 year or 2 years. We do have the flexibility to spread that out.
So if at the end, let's say, of course, this new thing is set to end in out years, I guess the question is that, let's say, for instance, and I guess the first question is, do you expect that you will resubmit for this waiver in the appropriate time in order to extend that waiver? If so, in the event that we were unsuccessful extending this shared savings program, what happens to those monies at the end of this period?
They will stay with us. I'll say that we will absolutely, well, whether I'm here or not, we will absolutely, I think, try to extend this waiver because it's been so successful for us. Can't guarantee we're going to get it. But any funds that we have in our account from the shared savings, once the waiver ends, we will still have access to those dollars because we actually claim those dollars and then they are in our budget.
Right. Well, the reasoning for that is in just playing it out, if we end up not being able to do that, my assumption is that the limitations on how we can spend the money, for instance, not on new services, but how we spend the money, those rules about how that money can or can't be spent would still confine those dollars even after the waiver ends.
Yes, I believe that's correct.
Okay.
I would expect that.
So when the rebasing, whenever the rebasing does occur to align with the neutrality cap, do you expect the cap to be more closely aligned with actual expenditures, or do you think we'll continue to see the amount of savings that we're currently getting?
We should, and should is the key word there. We should continue to see the types of savings that we've seen, because the methodology for the rebase it's actually the same methodology that we used for the first 5 years. And the rebase happens halfway through at 5 years. So it's the exact same methodology. Now, the caveat there is we're going to have some back and forth and discussions with CMS about what that looks like.
Mhm.
But from our perspective, it's very clear. It's set out in this terms and conditions of the waiver that it should work exactly like it did for the first 5 years.
If that's the case, though, of course, we're in uncharted territory. No other state's doing this. There's no historical inference that we can rely upon as to what will happen. But during that redetermination, is it your expectation that the federal government will, or HMS will, change the game such that through our effective management, that shared savings amount would decrease over time?
It's not my expectation. I would hope that wouldn't be the case. And what we will continue to stress with the federal government is you have to incentivize states to do what you want them to do, to be conservative, to be responsible, to be efficient. And if the only way to get more federal dollars is to spend more money, that's a loser.
Mm-hmm.
So we'll continue to stress that.
I appreciate that. And of course, we talked about the $980 million. Of course, with your guidance and recommendation, as well as that of the governor's office regarding how we are committed to using those dollars in out years, of course, it's $980 million. And there's all kinds of different ideas about how we can spend those dollars. I guess my question is, of that $980 million, I recognize that we committed those dollars to certain things, but how much of that money to date has been spent of the 980 so far?
Yes, and I'm glad you mentioned that, because it has all been obligated, but in terms of what has actually been, then there's what's actually been appropriated, because you can only appropriate for the next fiscal year,
Mm-hmm.
and then how much of that has been spent. So the spending, we just looked at this yesterday, about $180 million
Okay.
has been spent.
So we've spent a little more than half of the first year's savings.
Yes, but remember, even with that first year, we had spread that out over 8 fiscal years.
Right. Okay. I did want to follow up on something very similar. It's in some areas, and I'll pick one in particularly. Our mobile mental health crisis units that are across the state. I think as a part of TennCare, those mobile crisis units have a direct allocation from TennCare to provide those immediate mental health services across the state. And of course, we're in unparalleled times as it relates to the mental health of our community, much less the TennCare population as well. My question is when those direct allocations are done on a per person basis, what would be the reasoning behind why those direct allocations vary among different areas across the state?
Yeah, and I may have Dr. Root jump in here. I'll be very transparent.
Because someone in a mental health crisis in Cookeville and someone in Farragut,
Yeah.
it seems to me like on a TennCare basis that the price per person that we're directly allocating should be the same.
Yeah.
Instead of a 90% difference between communities across the state.
Yeah, we've had a number of conversations over the years with the TAMHO organization about this, and full transparency. And I've told this to them. If we were designing this program today, this is not how we would design it.
Mhm.
This was something that we inherited about 20. And so the challenge with that is when you inherit that, and there's already a distribution of dollars based on some odd formula, if you're going to make wholesale changes to it, then you're going to have winners and losers. What we have done since 2020, we've actually made 2 improvements with your approval, and we've provided increases for all of those providers, and we've tried to differentiate a little bit to make sure that those that are at the lowest are getting a little bit more. But it's a challenge, and we're certainly not married to the formula that we have. And I've actually asked the TAMHO organization. I've told them, I've said, why don't you all get together? If you can come up with something that you can all agree on, bring it to me and let's talk about it. But it's just hard to do because different members of that organization have very different ideas about how those dollars should be distributed.
I couldn't agree more. I think it is kind of unusual though, because it's on a per person basis. It should be a flat rate, even if it requires some people to be losers in their current rate. To me, it seems like it should be more balanced across this. Are those kinds of formularies? Obviously, you're talking about 20 years. It's been great. It's a success story, I guess is what you said. I guess my question is, are there a lot of instances in those direct allocations that there are variants? I mean, is it something we should be wholesale looking at, or is this like a one-off?
I'm not aware of, maybe Victor knows, but this is I think this is pretty unique. I haven't seen one quite like this.
All right.
Do you want to add anything?
Yeah, Dr. Wood, I'm not sure your microphone, there it goes. It lit up. You're recognized, sir.
Thank you. Victor Wu, Chief Medical Officer. Thanks for the question. Director Smith, I think, said all the important things. One thing I'll just mention is, again, this predates my time at TennCare, but I do believe that initially when these rates were the formula that was used, there was some accounting for the size of the organization and how many individuals they serve in their community. And so some organizations might have served a much larger percentage of Middle Tennessee compared to a smaller organization. Certainly there's opportunity for improvement in that, and we would welcome any input from our partners at TAMHO, but I do think there is variance across, but that was some of the genesis for how that came up to be.
No question about it. It's just weird when it's a direct allocation on a per person basis. Mental health crisis for somebody in Memphis shouldn't be different in a direct allocation than it would be in Knoxville. So appreciate your time. Chairman, thank you for the opportunity to ask the question.
All right. Thank you, Chairman. Next on the list, Deputy Speaker Zachary, you're recognized, sir.
Thank you, Mr. Chairman. Thank you, Mr. Chairman. Director, thank you to you and your team for your leadership. Chairman Williams covered some of what I was going to discuss regarding the shared savings, but I did want to say thank you for the highlights of the shared savings. And I think we probably don't need to move past that with just remembering some of the debate about, for those of us who were here when that passed, some of the wailing and gnashing of teeth about what we were doing, leading the way and doing it the Tennessee way, because we did expand coverage. We crafted a program that is unique, but we had the confidence in our state and the leadership that we had one of the best run Medicaid programs in the country, and we knew block granting those would allow us to provide additional coverage. Some of the things I wrote down: expanded coverage for pregnant women, raising eligibility thresholds. We extended postpartum coverage for mothers. We maintained coverage for children, dental coverage. The list goes on and on. All that would not have been possible without us running this the Tennessee way and experiencing that shared savings to allow us to be able to do that. So thank you for your leadership. Leading into that, talking about the Strong Family Initiatives, I think back in 23, we allocated around $230 million for that program to be able to move forward with some of the things I talked about. Can you talk about just the initial success of that program? Talk about some of the goals that were set. Have we achieved those? And then how are we measuring success today with that program? And just give us your overall view, a little bit deeper dive into that program.
Sure. I may have Dr. Rue jump in here. A couple of things that jump out at me when you go back to the Strong Families Initiative. One, it was that 12-month postpartum coverage that we talked about. We knew prior to we had a discussion, I think, in this committee about some of the results that we were seeing, some of the metrics on maternal health and maternal mortality. And there's no question that providing that extended postpartum coverage should help with those quality measures and should really help us improve as a state. The other one that jumps out at me is the increased eligibility for our parents. You'll recall that we closed the coverage gap. So previously we were covering parents at about 87% of poverty. And initially when that was put into place, it was at 100% of poverty, but it was a flat dollar amount. So over time, the value of that decreased to where we were at about 87% of poverty. We, as part of this initiative, we increased that to 100%, and it'll be 100% going forward. And the reason why that's so important is because a parent can't qualify for a subsidy on the insurance exchange unless they are at least 100% of poverty. And so we closed the coverage gap, which means that our low-income parents, have access to affordable coverage, which is really important. But Victor, do you want to talk through some of the quality outcomes and our expectations, and maybe what we're seeing?
Yeah, absolutely. Great question. Thank you so much for letting us have a chance to brag about the success of it. Certainly, as we thought a lot about the Strong Families, one of the things we recognized was, can we engage moms earlier, and can that also help our infant health, child health, and get them started off strongly with healthy treatments, preventative care, screenings. And I think two metrics I'll highlight for you that we've been tracking. We have a series of metrics that we look at to really help us, but we've seen both an increase in the number of moms who are getting postpartum care. So they're actually showing up after they deliver to make sure that they can get their health under control. We know that from some of the evidence that we looked at in proposing this, a lot of times the challenges that new families face are for moms in that late postpartum period, especially with mental health challenges. And so we're seeing more connections to care. And the other one that we're really proud of is we've seen a 6% increase over the last 5 years in the number of our children getting their well child visits. And at the well child visit, there's so many important things that happen. It includes things like screening for autism or developmental delays, hearing delays, making sure they're getting the preventative care, which may include vaccines if that's the choice of the family. And so we've seen a big increase in that as well. And I think part of the many different things have gone into that, but the Strong Families has certainly set us up in a good way.
Last comment, if I may, Mr. Chairman. Thank you for highlighting that. I think one of the things that strikes me in both your comments was increase, expand, and what we've been able to do with shared saving is to meet additional need for those who need it most. There's been a conversation around this country for years about expansion of Medicaid, and just throwing people on the rolls. According to FGA, roughly 82% of the people in other states on those expanded roles are able-bodied adults. What you've just laid out for us is through shared savings is how we've been able to address need for those who need it most. And so thank you for highlighting that. I'm thankful for the leadership and how we've been able to address the need in Tennessee, but do it the Tennessee way. Thank you for your leadership. Thank you, Mr. Chairman.
Thank you, Speaker. Next on the list, Chairman Hogg.
Thank you, Mr. Chairman. Director Smith, thank you very much. As you're talking about TennCare 3, there's probably a handful of us on the committee here that remember TennCare 1 and 2. So I appreciate where we are now with TennCare 3 and the evolution that has occurred and the good works that we're doing. Just a bit of thanks, the shared savings plan, what that did for our region in Northeast Tennessee recently allowed us to provide $100 million in the HEAL program, the hurricane relief, and no interest loans to help our communities get back on their feet again. And that is certainly recognized and appreciated. So I thank you for that. I do want to go down the path of ratios. And as Tennessee has grown in prosperity, our federal match, according to the FMAP trends, indicate that the state will be investing more monies. The federal government will be investing less monies. If you could go down the road of one, talking about our prosperity in Tennessee and also our growth in population that we've seen, but where we are now in terms of ratios and the reasons why.
Sure, happy to do that. And Zane's probably got the history on that and can talk through kind of where we've been. But you're right, it's a good story because as a state, we're doing really well relative to other states. The federal match is based on per capita income. And so as our per capita income goes up relative to other states, our federal match goes down, which means we have to come up with more state dollars. So it's good news, but it does impact our state budget. Zane, you want to kind of walk through the
Zane Sills, Chief Financial Officer. Thank you for the question. So our FMAP rate, that's called FMAP, the federal matching percentage, it changes every single year. As Director Smith mentioned, that's a figure that's given to us by the federal government. They look at every state in the country and they look at your personal income in relation to every other state's personal income. So the general idea is if a state's personal income is higher, the state is more well off and should be able to afford to pay more of the share of its Medicaid program. So a better a state is doing economically, the worse the federal match rate gets. And so what we've seen is now a decline in our match rate 5 years in a row, which is also a sign of a strengthening TennCare economy or a Tennessee economy compared to the rest of the states in the country. But we have seen significant cost increases year after year after year in the budget as we have had to recognize that our match rate is going down. The current match rate is at 64.323%. Just as a point of reference, when I started over a decade ago, we were closer to about 66%. Even a 0.1% in this match rate on a budget of our size can have a really large impact. So when we see the match rate continuing to go down by 0.1% year after year, it does require the state to put in a lot more state dollars. But again, a great sign that the Tennessee economy is doing very, very well.
Chairman Hall.
Thank you, Chairman. And important to note that this legislative body has made those investments and we will continue to make those investments as they're requested. It's something that there's always, this part of Tennessee and that part of Tennessee. Are we able to address that particular situation? This may go to Zane, forgive me, as well, but are we able to address this on a county by county basis, or is it more of a blanket across the state? And I just asked theoretically, could it be available in the future on a county by county or region by region basis?
Thank you for the question. So this is done at a statewide basis. So there is no option for the FMAP rate to change on a regional or county basis. I think what I will say is, as we look across our state, we all know we have 3 grand regions and they're very different. And the way people behave and the way people consume healthcare in those regions is very different. The patterns that we see among our population are different. And so when we build our capitation rates through our MCOs, we actually separate that into 3 grand regions. We have East, Middle, and West cap rates. And so all of that data is driven through our actuaries, and they set actuarially sound rates. So they do account for regional differences when we're funding essentially how much money is going to different regions in the state through the MCOs to pay for healthcare.
Chairman Hall.
Final question, Chairman. Thank you so much, and thank you for the answers. As we have the public health emergency in the rearview mirror now, and I'm looking at slide number 7 that gives us the peak where we were with enrollments and now where we have leveled out to historic levels of where we are, which is still percentage-wise below historic levels because Tennessee's population has grown well over 7 million people now. And this may be an opinion type question to ask anybody on the panel, but is this the new normal? We talk about new normal. Is this, we feel we're back to a level where we should be in the state of Tennessee?
Yes, I think what we had assumed and predicted even during the pandemic was that when we got through it, we would be back to where we were pre-pandemic. Although I will say that we were trending down prior to the pandemic, prior to the pause. And so we hadn't even reached our normal necessarily because we were trending down, which why I think is why what you see now is we're actually below where we were pre-pandemic. But also kind of going back to what you were talking about earlier with how we're doing relative to the rest of the country, as our state does better, as our incomes increase, we should see a decrease in our population. And I probably said this before to this committee. Medicaid programs, across the country, we tend to talk a lot about how we can get more people onto Medicaid or how we can serve more people in Medicaid. We need to spend more time talking about how we can get people off of Medicaid, not penalizing them, but because they've improved their lives and they've improved their life outcomes, so they don't need Medicaid anymore.
Chairman Hall.
And I said I was going to hush, but that brings another question to mind. The next presentation we're going to hear in a few moments or 30 minutes or so is from Department of Human Services. And I believe we're seeing some good work from some of these TANF programs, these Families First programs that are geared to do exactly what you're saying, that are working with individuals in the working population to continue to provide these wraparound services so they don't fall into the area where they need TennCare in the future. So I think hand in glove, what we're doing in other departments is working well with what we're doing in TennCare.
Right. And I don't want to be misconstrued. What I just talked about, how we need to talk about how we can lower our Medicaid enrollment because we're improving people's lives and their outcomes. But we know we have a lot of people that leave Medicaid because their income, maybe they've gotten a higher income to taking a better job, but then they come right back. We have a large percentage of people that churn right back onto Medicaid. And so what we should do and what we need to think about we can do that in conjunction with our other departments and things that you were just talking about. What can we do to provide supports so that we can help people as they transition off of Medicaid so that they don't have to come back on?
All right, thank you, Chairman. And we do have several more folks on the list, but I do want to ask a quick question regarding some technology investments that TennCare has made. And looking at the Medicaid Management Information System, or MMIS, the numbers that I have, the state spent about $102 million, and that's been state dollars on this new MMIS system. The estimated completion date, and correct me if I'm wrong, but that's supposed to be in January of 2027, I think is the date that I have. 23.5 million of total state funding used for MMIS is recurring dollars. So keep that in mind. I want to come back to that in just a second, but I do want to ask a little bit about that. Are we on time with that? What's the expected lifetime of the system? That's very important as well. So can you talk a little bit about the system? Also, will the system need continuous updating due to CMS policy changes and things like that, Director?
Yes, and I'm going to defer to Zane here. Well, what I will say is we recognize it's a very large investment. I think at the time we started anyway, I think it was the largest state technology project. This really is the brain of TennCare when you think about all the things that it does, everything from provider payments to like pharmacies involved. And I'll have Zane kind of go into the details on that. But it is a very large investment. A lot of this is due to federal requirements, and that's why you see such a large federal match. But one of the frustrating things is that federal requirements change all the time. And so what was one requirement when you start the thing becomes a different requirement later. And it's still a requirement. So you still have to do it. But Zane, why don't you?
Great. Thanks for the question, Chairman Hicks. I think there were several things there, so I'll try and address them all in order. And hopefully I address everything you asked about. Just before I get into some of the specifics, just to set a little bit of context on our IT budget, we recognize that we have a very large IT budget. Wouldn't deny that. It is a lot of money. But one of the things that I would like to highlight that it's important to contextualize that within the size of, we're just a very large budget in general, or almost a $19 billion agency now. And so one of the things that we do when we're managing and tracking our IT spend is that we benchmark ourselves against other comparable entities to make sure that we're coming in lower. We always compare very favorably. So just for a little context there, the average IT spend for a healthcare organization is about 5%. If we look at federal government agencies, they spend an average of about 8.3% on their budget on IT. And our budget is about 3.3% IT. And if we look at the state dollar budget instead of the overall budget, because we do get enhanced matching dollars from the federal government on IT of about 90-10, that percentage is even smaller. That's about 1.7% of our state dollar budget is spent on IT. So we do come in considerably less than the benchmarks and comparisons that we look at. That results in savings of hundreds of millions a year annually if we compare ourselves to if we were just performing at the average level. So I do want to set that context. Another question you asked was about the finish date of MMIS, and I think you cited January of 2027. So that's an old date. We have not talked about this in front of this committee yet. I haven't had an opportunity to talk about this in front of the Fiscal Review Committee a couple of times over the past few months. We have pivoted on our MMIS strategy in the past few months. So when the second Trump administration came into office, they granted new flexibilities to states on how states were supposed to modernize their MMIS systems. There had been a strategy that had been in place since about 2015 or 2016 when the federal government really started driving states to update and modernize their MMIS systems. And I think what we've seen over the past decade is that strategy that was designed at the federal level in 2015 or 2016 was, or earlier than that, actually about 14 or 15, that was a strategy that was costing a lot more money than people originally thought at the time. So over the past few months, the Trump administration has granted new flexibilities for the first time. And so we pivoted from a modular strategy to just a wholesale replacement strategy. The upshot of that is that should reduce our out-year spend by millions of dollars. And so it does postpone the completion date for updating and finishing the MMIS upgrade, but it should save money as compared to the previous strategy. So that addresses that. And then the other thing that I would like to highlight is you had a question about, well, when do we finish? What does the budget look like? So we've already hit the high point in our IS budget. It's come down over the last year, and we're projecting it to come down a little bit further and then kind of level off. The thing with IS in the Medicaid space is that even if you build a new system like we've done with our eligibility system, and even when you build a new MMIS system like we're currently building, we still always have to make changes to it. I compare it a lot to Nashville, right? We have a big functioning city, but you walk outside and there's 20 or 30 construction cranes everywhere you look. Because of changes that happen every single year at the federal level where we have to make eligibility policy changes and other changes to how we deliver our care, because of laws that this General Assembly passes, because of other policy changes that happen, we have to modify our IT systems to essentially fit within those new frameworks. So even once we have a new system, we'll constantly be adding modular additions, making modifications. That should all be handled within our kind of ongoing IS budget. Like I said, that's come down a little bit from the peak.
So, Mr. Sills, sticking with that, so who actually pays for the maintenance? Is that the state? Did they pay the entire cost for any maintenance, or is it a kind of a split there with the feds? How does that work?
That's a great question. So most of Medicaid state administrative expenditures are matched at a 50-50 level, which differs from the match rate I talked about just a few minutes ago. So $1 state, $1 federal. IT is matched at a different and higher rate. If it's maintenance, it's matched at 75-25. So the state pays a quarter, the feds pay 75 cents. If it's new implementation, they will pay at 90-10. So the state pays a dime, the feds pay 90 cents. And once you get past the implementation and you build something, then it switches to that maintenance of 75-25.
So there's 23.5 million recurring dollars that's used right now. What happens once the system is up and going? What happens with that recurring monies?
So the recurring money is part of that'll be ongoing. So anything that's recurring is being directed towards kind of maintenance.
Okay.
At any given time, we're doing maintenance, but we're also doing new builds. And
Okay.
so we've got the recurring is the 75-25 and the new build is the 90-10.
Okay, got you. Thank you very much. Next on the list, Chairman Hulsey, you're recognized, sir.
Thank you. Thank you for being here. I have actually two questions for you. One is the federal government just recently passed the Rural Health Fund, And the anticipation was, I think, 25 million per state on one part of that issue and 25 million on another. 3-point question there. Have we applied for that? If we have, do you have an anticipated date when there'll be distribution on that? And do you think or how much of all of that do you think we'll qualify for?
First, we absolutely are going to apply for that. That is being run through the governor's office. So we're working closely with the governor's office along with our Department of Health and other departments. And I know there have been some legislative conversations through the governor's office as well. So we are absolutely going to apply for that as a state. The due date for that is November the 5th, I believe. And then the federal government is they said they're going to make the announcements by the end of the year. So this is all moving very, very fast. I've got even better news for you. There's the first half of that. You mentioned the two halves of the program. The first half actually should result in every state receiving $100 million a year for 5 years. So 500 million total. And then the second half is going to be competitive. And we think that Tennessee is in a very good place and well positioned to receive a good portion of that second half. So we fully believe it'll be more than $100 million a year for 5 years.
Okay. Yes, sir, Chairman.
Thank you. And I'm sure you've been asked about this. Just want to know your thoughts. In my district, I have doctors that are friends of mine, and then I have groups of doctors that are just in my district that I know, but they're not necessarily friends of mine. The districts, the districts around me also have doctors groups that I have met with, and so as Chairman Hawk met with us, and I have doctors who say to me, "I'm not doing this anymore." The commercial rate for treatment is X amount. The Medicare pay is 50% of that, less. And the TennCare rate sometimes runs 35% less than the Medicare rate. And they're saying, I'm not doing it anymore. I'm not taking any more TennCare patients. I can't even pay my overhead. I'm told we have doctors leaving the state over this because the rate is so bad. I got a bill trying to fix this. It's parked behind the budget. I don't know that I got the right answer. But I want to know your thoughts on how in the world we're going to fix this and deal with this because these we can't expect doctors to treat people for nothing. And that's the complaint that I get all the time is we're going to quit or I'm not taking any more. And of course, you understand the downside to that. If you've got, particularly in rural areas, people who don't have access to a primary care doctor, then they don't get it treated until it gets so bad. And then they go to the emergency room and then it costs you way more than what it would have had they got preventive medicine at the time. So you understand the problem. Mm-hmm. I just want to know your thoughts on how we fix it.
Yeah. Well, I appreciate that. And I can tell you that the challenge around rates and provider rates, it's a challenge that every Medicaid program in the country faces because providers, they want to be paid as much as they possibly can be paid. And I fully understand that. As a state, we have to be conservative in what we pay it. And if we're not, then we're going to be right back in that position that I talked about earlier. So there's a proper balance there. And there's always a healthy debate between the providers and the payers. In our case, we contract with our managed care organizations and they do the negotiating and they set the rates with our providers. I can tell you that, and we had a big discussion about this last year as we were discussing rates. I can tell you that we're not seeing a decrease in our network when it comes to physicians. And so we have not seen a mass exodus of providers from the TennCare network. And what we always want to do is, for us, the thing that we're going to look at the most is access. Do our members have access to the care that they need? And if we have that access, then that should mean that the market is working and that we're paying what we need to pay. Medicaid is not designed to pay commercial rates. It's not designed to pay Medicare rates. If we did that, we'd be in a really bad spot, and we'd have to come to you for. We would have one of those holes in our budget that I was talking about that other states are experiencing. But we absolutely want to. We want our providers to be compensated well enough to where they can accept TennCare patients, and that they can be stable. One thing we heard last year, particularly around physicians, and I'd heard this for a couple of years. I had heard one of the groups say our doctors never get a rate increase from TennCare, and I knew that wasn't true because we work through our managed care organizations. It is true that we don't give across the board rate increases, but we let the market determine where our rate increases need to go. And that's sort of the principles behind managed care, and it's worked very well for us. I'd say it's been the biggest driver of our success. So what I had our team do is I wanted to see in aggregate, what have we done for our professional services, our physicians over the last 5 years? Let's just pull that and let's see what we've done. So we did that. And again, this is not across the board, but it's just an average. When we look at the previous 5 years, we had given on average a 3.5% rate increase. So you think about 3.5, that seems pretty good, but we said, okay, well, let's compare that to the CPI for physician services. So nationwide, it was 1.9%. So we were considerably higher than the national CPI for what we've done for our physicians. Now, is it enough? I think that's going to depend on where you sit. If you're one of those physicians, it's more likely that you're going to have the opinion, no, it's not enough. If you're trying to run a TennCare program and you have all of the other obligations, including the obligation to this committee and to the overall state budget, if we're seeing an adequate network and we're seeing that we're not having providers leave our network, then I'm going to lean on the side that at least for the last 5 years we've done pretty well. But it's a constant challenge. I'm not trying to dismiss it at all. And it's a particular challenge right now because again, if you look at what's happening across the country in Medicaid, many states are doing across the board rate decreases. They're not even talking about increases. They're doing across the board rate decreases. It's a very difficult time in Medicaid right now.
Thank you. Next on the list, Representative Reeves. You're recognized.
Thank you very much, and thank you for coming in front of the committee today, and thank you for what you do. I have a question about chronic conditions, in particular metabolic conditions, and a report that TennCare contributes to every other year is the Diabetes Action Report. And looking at slide 6 and then also the report that was issued in February, it appears that this is a growing issue. 1 in 7 Tennesseans were reported as having diabetes. Roughly 1 in 5 cases are undiagnosed, and 1 in 4 Tennesseans over the age of 65 lives with that disease. So it appears to be increasing with age, and of course we've got an aging population. And then to boot, about 25% of those that make under $25,000 a year, about 1 in 4 of those are diagnosed with this condition. So given those numbers and our aging population, number one, are you seeing growth in chronic condition-related expenses within TennCare? And then what proactive steps are you taking to get ahead of that curve and improve early detection and prevention? If you could address that. Thank you.
Yes, thank you. And I'm gonna turn this to Dr. Rue because I know it's something that he and his team look at.
Thanks for the question. And certainly we recognize that diabetes is a really important, but there are many chronic complex medical conditions that that have a higher prevalence in our TennCare population. So maybe to the second part of your question first, we absolutely do a lot of work to try to identify diabetes and other chronic conditions early in the process. And so both in partnerships with our primary care providers and with hospitals and also our MCOs, there's multiple prongs that we do that with. Some of it is helping to empower primary care practices to do screenings, to treat patients earlier, to get them in, to engage those members that are at risk and helping identify those for them to be able to outreach and support. And then secondarily, our health plans all have what we call population health programs. So they use care coordinators, navigators, they use nurses, dietitians, pharmacists to then identify individuals who are at risk or have diagnoses of chronic medical conditions like diabetes. And then they do outreach, whether that's through texting or through calls, but they offer additional services to help them navigate to those services. And so we've seen some really great results from our health plans in terms of how they both partner directly with providers, but also where they're doing direct individual outreach. And we've seen some good movement in our quality measures. Now, certainly there's a lot more opportunity. For every individual that we impact, we know there's others that are not presenting for care in a timely way, or they're using the ED as instead of using primary care. And so we have a lot of opportunity to continue to work on that, but we have the right infrastructure and the right population health type programs to really tackle that. And the second thing I would think is your first question around costs. And certainly we've seen some increased costs across the board, but that's really reflective as well, not only of services, but as new medications come on the board or new treatment types that are all really exciting, but also can be very expensive. We do cover all those services. And so we've seen some growth in costs as well.
Representative Reeves.
Yeah, thank you. And I'll just follow up real quick. So looking at the 23 report that was put out, it looks like that population in Tennessee has grown from 9.9% of the population of diagnosed cases to 14.6. And so it does look like this is a growing issue, not just within TennCare, but across the population. So I would like to work with you guys to figure out ways to get ahead of that curve. Thank you very much.
Thank you. Chairman Grills, you're recognized.
Thank you, Mr. Chairman. And Chairman Hulsey pretty much took all the question I had. Only thing I would ask is, could you prioritize what that application and the services that may be a priority?
The rural health?
Yes, sir. I'm sorry.
Yeah. So the way that application is set out in the notice of funding opportunity, there are different buckets. I think in terms of priorities, you're going to see a priority around workforce development. I think there'll be a priority around technology improvements and infrastructure, and then I think you'll see innovation, and then I think you'll see something around right sizing facilities to try to help rural communities be able to have sustainable operations that are able to serve the specific populations and the numbers of people that they need to serve. It's probably an oversimplification. I don't want to get out ahead of anybody else.
Thank you, Mr. Chairman. And go on to the next person.
All right. Thank you very much. Chairman Hale, you're recognized.
Thank you, Chairman. Director Smith, to you and your staff, enjoy working with you. And so just a couple of real quick questions. First of all, and we had conversation, we've talked about it a little bit, talked about it with Ashley on your team, is there was a list after the big, beautiful bill. There was a report of some hospital closures, and 3 of those are in counties that I serve. If you could maybe hit on that, and then also as a part of the federal that you mentioned earlier, the rates through 2028 and how that affects hospitals and the benefit of that through 2028, if you could.
Sure. I'm aware of that report that you mentioned, but I'm not clear as to how they came up with. I don't know what their methodology was, and so it's hard for me to comment on whether that's accurate or not. In terms of the big beautiful bill and the impact on hospital rates, I probably need to go back a couple of years ago in partnership with the Tennessee Hospital Association, Chairman, you sponsored that bill to allow them to increase their provider assessment, which would then allow a substantial amount of new federal dollars to come into the state. And we worked over the course of 2 years and finally got that approved by the federal government, actually right before the big beautiful bill was passed. And so that's going to be a massive investment to our hospitals, and that's actually already started. One of the provisions in the bill, and that is paid through what's called a directed payment. One of the provisions in the bill requires states to reduce directed payments and by 10% a year, beginning in 2028, until we get down to 110% of Medicare rates. And so you can kind of think about it like this. You know, we were here on our rates, let's say, and then now we had a big jump. And then over the course of the next 10 years, starting in 2028, we're going to start coming down. So there will be an impact. As you and I discussed, as you mentioned, there will be the benefit of the typically an annual Medicare adjustment. So it's hard to say, like, when it's all said and done, where we're going to be, because again, it's based on the Medicare rate. It'll be 110% of Medicare. The other thing I would say is, as we all know, a lot can happen between now and 2028. So we'll have to see how it all plays out, but there will be an impact if everything stays in place. The same is true for our EMS providers, because they also have an assessment. And then our academic physician groups, and then potentially nursing facilities.
Okay. One more
You
question.
recognize Chairman Hill.
So in going with that, with the ambulance, did they see an increase in theirs as the hospitals did?
The ambulance is unique in that we actually have a state statute that sets a percentage of Medicare in our statute. And then on top of that, they have an assessment of their own. And so when you add those things together, which is how the federal government will calculate it, it actually is higher than 110% of Medicare. And that's why there will be an impact on those providers as well.
Okay. All right. Thank you, Chairman.
All right, thank you. Next on the list, Leader Camper, you're recognized.
Thank you, Mr. Chairman. Thank you for being here. Could we go to slide 8, please? You mentioned a minimal TennCare eligibility impact from the One Big Beautiful Bill. So recently, there's been some reports of about 250,000 people, Tennesseans, that could lose their coverage as a result of the Big Beautiful Bill. And I think you were quoted with saying, get this correct, that there was no scenario where you could see this happening. Could you give us a little bit insight on your anticipation of the impact of the Big Beautiful Bill on Tennesseans?
Sure. And I'm glad they have had the opportunity to address that.
Yeah.
So I am speaking to the impact on TennCare. I'm not speaking to any other impact. I've seen, unfortunately, some of the media reports have just been completely inaccurate. And it's understandable. It's a very complex issue.
It is.
But I've seen some reports that said that TennCare will be cutting 200,000 plus members. There is no scenario where that happens. I think what's happened maybe is it's gotten convoluted with the potential impact for people that have coverage through the marketplace or through the exchange, which is that's not TennCare, that's not Medicaid. And the reason I'm so confident in that is when you look at the provisions of the bill that deal with eligibility, they overwhelmingly apply to the expansion population. And because we're a non-expansion state, we just don't have the same level of impact as some other states.
Okay, thank you for the clarification. And further down on your slide, where your last point their Medicaid payments to TennCare. Could you expound a little bit more on that?
Sure. So that relates to the shutdown. And because Medicaid it's a mandatory program, there have been no negative impacts. We're still receiving all of our dollars. We're still making all of our payments.
Okay, very good. And lastly, with respect to the potential impact of SNAP benefits going away, I know you all do some medically prepared meals and things like that. Do you see that that would be impacted with SNAP benefits going away? Or do you see that those medically tailored meals will be increased? Or how do you feel that TennCare recipients would be impacted by the
Yeah.
potential loss of SNAP?
So the things that
benefits?
we do through our program, those will continue. Those aren't impacted by the SNAP, anything to do with SNAP. And I think what you're specifically talking to are what we do through our Choices program, which is for seniors and individuals with physical disabilities.
Right.
And so all of those, that benefit's going to continue.
Okay, I was thinking because they were recipients of, some of them are recipients of SNAP benefits and they will be impacted. And particularly our elderly that can't get to some of the food banks and all these other options. I was hoping that this program would continue to be able to serve at least that population. So,
Yes, that's right. And related to that, one of the investments that you all helped us with through our Health Starts initiative is we have a closed loop referral system that is now up and running. And the whole idea behind that is as our members seek care through their providers and they are screened for non-medical needs, such as food insecurity would be one of those, then our providers can utilize that system to identify community resources that are available to assist them. And so we think that that also could be a real benefit during this time.
okay, thank you. I appreciate it. Thank you, Mr. Chair.
Thank you. Chairman Vaughn.
Thank you, Mr. Chairman. I appreciate y'all being here. I appreciate Leader Camper's question, also Chairman Hale's question with regards to the big, beautiful bill, because I appreciate the fact that your relationship with the federal government has been sort of got to have given you whiplash over the last few years. It's a very dynamic relationship and y'all are so dependent or so partnered with them with regards to what's going on. And so I just want to clarify something because I didn't understand this. And it's kind of scary whenever you're about to ask a question that you don't know the answer to. I too had read a variety of media reports that would talk about the negative impacts of the big, beautiful bill on Medicaid programs. And so as I would read these articles, I'd say, okay, where are we? And I never could find people from Tennessee listed in the article, nor did I find Tennessee referenced in the article. And after hearing today about what our block grant status is, and the fact, and I want to reiterate what you just said, the fact that we are not a Medicaid expansion state has insulated us somewhat. I'd like your thoughts on, how much insulation and how much protection has that given your organization from the dynamic relationship with Washington, D.C.?
Well, there's no question on the eligibility side of things. It has decreased the impact that we would have faced because, again, those provisions relate almost entirely to the expansion population. And so the two big provisions there are, one, you have to have increased eligibility checks. So instead of once a year, you have to do that twice a year. But that's only for the expansion population. And then the other one is the community engagement, or otherwise sometimes referred to as work requirements. And that one, too, almost overwhelmingly applies to the expansion population.
Mr. Chairman, if I could,
you're
one more
recognized.
follow-up.
Yes, sir.
So as you say those provisions start in 2028, when do we reapply for our block grant? Are we going to see kind of a convergence of a lot of variables? And have you done a physical analysis of what the bill says, the impacts of the bill to our state and our future budgets as it stands today? And how much impact could the reapplication for our block grant status in the future Well, who knows? But at that point in time, we're dealing with so many variables.
Yeah.
We can't calculate it. But could you give us the timeline for how those things match up? And then also, if you've done any analysis with regards to, I know we're insulated to a large degree, but what those fiscal impacts may be down the line.
So our waiver goes through 2030, calendar year 2030. So we will apply. Well, I mean, we'll get to work on that 2028. Probably apply. We'll apply in 2029 for that next waiver. It's really difficult. Well, one, it's impossible to know what the world's going to look like in 2029, 2030. But it's also very difficult to do a fiscal analysis with any certainty because one, we're still waiting for the final guidance from CMS in terms of how they're going to implement the provisions. And until we get that, it's impossible to know. As I said, on the eligibility side, we think there's minimal impact. We do know for some of these providers that we just talked about, starting in 28, there will be an impact. But it's not necessarily an impact to the state budget because, for example, this is an important point, in the case of the hospital payment, the hospitals are paying the state portion, the state match portion for that, and then they're drawing down the federal funds. So it's not as though the state budget is going to be impacted. Now, if it results in access challenges, and we've got to make some changes because of that, then there is an indirect impact. But it's because we've been asked by the media, well, give us the fiscal impact, or what's this going to look like? What's the cut going to be potentially? It's impossible to do that. It's also impossible to know how each hospital will deal with those changes, will navigate those changes, and what actions they may take, because the hospitals, they're all in different positions.
Chairman Vaughn.
Thank you, Mr. Chairman. I appreciate the candor with regards to that, and I appreciate the way that you deal with answering the question very directly. So thanks a lot, and appreciate it.
All right, thank you. We do have one more person on the list, and I'm just going to ask, we have went over our time, so just be respectful of that, but just ask quickly, answer quickly. Representative Miller.
Thank you, Mr. Chairman. Director Smith, thank you and your team are doing a pretty good job in trying to manage TennCare. But when you started your presentation, for some reason, I got stuck on slide 7. And, and just visualizing, it's almost like going up the mountains, and these are representing people, right? And for some reason, it started January 20th, and it peaked in January 2023. I don't know exactly why. You probably have already answered that. But then all of a sudden, it falls off this cliff, off of this mountain. And I was, thinking, okay, why did that happen? And what happened to these individuals? In your presentation, you talked about it got better for some individuals economically, so they left, but they came back. And that's, again, what I'm thinking. How many actually came back? And that's pretty much my question. And second question to that, what happened to those that didn't come back? Do you all have any idea of those Tennessee citizens that are no longer under TennCare?
Yeah. Well, I think there's the first part of that, I think there's an easy explanation. Remember when the pandemic started, the federal government put a pause on all redeterminations. So typically every year we have to go through a redetermination process to make sure that every individual that's on TennCare is still eligible. And if they're not, we have to remove them from the rolls. Well, when the pandemic started, the federal government said no more redeterminations. So there's like a 3-year period where That's why you see the sharp increase, because people were coming on to TennCare, but nobody was coming off because we were prohibited from removing anybody from the rolls. Then it got turned back on. And so we started going through our normal process. And that's why you see the sharp decline. I will note, when we look at the people that came off, in terms of those, some people come off because they just don't respond. But when we look at that, we found that 40% of those had other insurance. So it's very possible they found other insurance. They had employment either through an employer, maybe some went to the exchange. But we don't know exactly why people choose not to respond or why people come back on, they don't come back on. Every situation is different.
All right, thank you. Director, thank you. Thank you and your staff for being here, and certainly thank you for your presentation and your answers this morning.
Thank you.
All right, we will move right along. Next, we will have the Department of Human Services, and we will ask Commissioner Carter and his staff to please make their way to the front. Commissioner Carter, good morning. Thank you for being here, sir, and certainly good to see you. Apologize for running over just a little bit, but if you would begin just with a brief introduction of yourself and your staff, we would greatly appreciate that. Thank you, sir.
Good morning, Mr. Chairman and members of the committee. Clarence Carter. I'm Commissioner of the Department of Human Services, and I'm joined this morning by our Deputy Commissioner and Chief of Staff, Whitney Page, and our Assistant Commissioner, Callan Baggett, Assistant Commissioner of Public Information and Legislation. I'm usually joined by the rest of my deputies, but they are back at the office following and monitoring the very fluid situation that we have with the federal shutdown. So, so the three of us, I'm sorry. Oh, okay.
All right.
That's it.
Listen, let's stay focused just on the presentation before us, and sorry about that, Commissioner Carter. Would you please continue?
That's just fine. With that being said, I'm excited to talk to you about the work that the department has undertaken over the past 5 years. One specific highlight I want to hit is our TANF reserve. As you may remember, when I assumed this responsibility just about 5 years ago, we had the largest unexpended balance in the country. It was north of $700 million. In partnership with you and the governor's office and our department, we have drastically reduced that unobligated balance, put it to use in very efficient and effective ways that you will be very proud of. And so we have resolved that very significant problem to the benefit of needy Tennesseans. Okay. Our TANF Opportunity Act, which was the collective result of our addressing this problem, it has resulted in the most innovative work in the human services space any place in the country. And you will see dramatic results that will prove that with intention, we can actually use the human services system to grow capacity that ends up in the reduction of dependency. So we'll be pleased to share that work with you. And as I am certain that you have many questions about our current circumstance, I'm happy to relinquish and turn it back to you, Mr. Chairman, for questions.
All right, thank you, Commissioner. And we do have several folks on the list. We're going to begin with Leader Lamberth.
Thank you, Mr. Chairman. And Commissioner, thank you for the work that you do. You've done a phenomenal job over the last several years and came to Tennessee extraordinarily well qualified, and you've used those talents to the benefit of our constituents. I wish we were here today and could talk about all of the phenomenal things that you have done as Commissioner and that your staff has done. But I would be remiss to the 7.2, 7.3 million Tennesseans that are out there if I did not talk about the obvious looming question. A bipartisan group of senators has attempted 14 times to open the federal government. I hope that that will happen soon. Our constituents, our friends, our neighbors rely on specifically SNAP and WIC funding that on October 1st, with the government shutdown, has lapsed. The USDA has already stated that states will not be reimbursed for SNAP payments if they choose to continue them. There is no way to utilize state funds, from my understanding, to actually continue a federal program and have any hope of those funds being reimbursed afterwards. So here is what I think is one of the most important questions that we could ask you today. When will the first missed payments take place, assuming the federal shutdown continues beyond the day after tomorrow?
So, Leader Lamberth, I appreciate the question. So we have 690,000 Tennesseans that are on our SNAP rolls. And as of Saturday, they would not receive benefits. The way the system works is that we send a file to our vendor 2 weeks prior to the beginning of the month, and then those benefits are loaded and distributed on the first of the month. So as of Saturday, those individuals will not be receiving those SNAP benefits.
Let me be clear. Because of the federal shutdown on this Saturday, day after tomorrow, our constituents that have relied on these benefits for food will go, and when they scan that card, it will have insufficient funds and they will not be able to purchase that food. Is that accurate?
Unless any of those individuals have unexpended funds from the previous month, then that scenario is exactly correct. They will not have any new benefits loaded to those cards.
And what is the monthly liability on SNAP that we invest in that particular program? So it's 690,000 Tennesseans. What is the monthly spend on that program then?
$145 million. And Mr. Leader, the reason that even if the legislature were to make state funds available, it's not possible to use the existing delivery mechanism because the card mechanism is tied to lines of credit of the federal government. And so we could not, we don't have the ability with state funds to load the card. So you would have to create an entirely different distribution mechanism, which would be extremely complex.
And I'm assuming that that would also take a lot more time than the next 2 days.
It would take a ton more time than the next 2 days. Yes, sir.
So let me ask this question. Is the department providing any guidance to SNAP recipients for alternative methods for obtaining food during this federal lapse in benefits?
We have been working diligently with the Governor's Office of Faith and Community to put together a statewide resource map of as many different feeding possibilities all over the state, and have made that resource map available on our website.
Well, I'm disappointed that that's necessary, but I would ask all of us in this room to continue to do that in our communities. I know that I've already started working with our local United Way of Sumter County, with several of our churches, with several organizations. And I'll get back to that in a moment, but just trying to think outside of the box here. You mentioned TANF reserve dollars a while ago. Can those TANF reserve dollars be utilized to potentially try to somehow or another put a Band-Aid on which is a massive gaping wound that the federal government has created here in our food delivery process?
So we have, again, it's part of what I was speaking about in my opening. Okay? We had this issue of the TANF reserve, and it was our job to engage that reserve. And so we have fully engaged that TANF reserve. So every dollar in that reserve already has a purpose and is accounted for. So they're essentially, other than the rainy day fund, there is no or TANF reserve. It was our job to spend it.
Well, and you've done a good job of that, and we gave specific instructions from this body to make sure that that TANF reserve was spent down from the $700 million and utilized for Tennesseans instead of sitting in a bank account. But now here we are. I will only say this, and then I know there's lots of other folks that are going to have questions on this. I'm sick and tired of seeing political games being played over people's food that need it desperately. There's a bipartisan group of senators that have already voted on a continuing resolution to reopen the government. I hope that there continues to be a bipartisan group of senators that can step up and put Tennesseans and Americans above politics. So I appreciate the job that you do. I am sorry that due to the federal shutdown, you've been put in the position you have. But I'm grateful that you're there to be able to lead us through this. Please continue to advise us on how best we can serve our constituents. Thank you.
We will do that. And I have to tell you that our staff, and I am blessed to be working with some of the finest public servants it has ever been my ability to work with in my 33 years of doing this work. And they have busted their backsides to do everything possible to ensure that we continue to provide the services for vulnerable Tennesseans, and also to protect our staff to the greatest degree possible.
Thank you, Leader. Next on the list, we have Speaker Zachary. You're recognized, sir.
Thank you, Mr. Chairman. Commissioner, thank you to you and Cal and your team for all the work that you do. Thank you, Leader Lambert, for that questioning. That was important for the people of the state to hear. And then just to ensure, piggybacking on that Tennesseans are aware, because they will be asking, where do we go? feedtennessee.org, feedtennessee.org. The governor put that out this morning. It is a comprehensive list of where to go, not just with our local faith community, but also organizations around the state that'll be able to meet the need. I know just in East Tennessee, on Saturday, Mission of Hope will be doing a massive food distribution in Jellicoe at 10 a.m. So our faith community, our nonprofits are already stepping up to meet a need where the federal government has failed us. So thank you for your work and your team. Just quickly, just because I was going to ask these questions, even in light of what Leader Lambert was talking about. In the big, beautiful bill, there was a change to the work requirements requiring able-bodied adults to, I believe, work and volunteer at least 20 hours a week. Can you give us an idea of what percentage of SNAP recipients in Tennessee fall under that would be within that 20-hour work week? And then what kind of reduction have we seen based on that?
Thank you for the question. We can follow up with you on specific numbers on that. It is a bit too soon to tell some of the ABOD information from Big Beautiful Bill, as we have been urging our customers to certify their information. If they are eligible, they do need to submit that information on our customer portal. Even if the government is shut down, they need to continue to update their information. So we can follow up with you at a later time, but it's a bit too soon to tell from Big Beautiful Bill.
Okay, great. Thank you. And then one last question, just regarding payment error rate within that program. Do you have any idea, and you may have to follow up as well, that what historically that has been?
We have, over time, been able to reduce our payment error rate. This past year was 9.47. Now, with the changes from the Big Beautiful Bill, in any state that their error rate is north of 6% will then have to pay a portion of the benefit, and which has historically been 100% federally paid. And so we are working diligently to get our payment accuracy rate under that 6%. And we have this next fiscal year to achieve that objective, because the if you would, the penalties for that will begin in fiscal year 27.
Commissioner Collins, do you have any idea what the average is? What, if we're at 9% now and we've gotten that down, what the national average is?
I would have to get the national average.
Or where we rank, where Tennessee ranks?
So we've done a little bit of analysis as we looked at different plans. There's reports that I've seen that 11% is the national average. There are, Whitney, can you remember the number under 6? It's very small, but you also have to look at caseloads of states and compare different caseloads, because if they have a smaller caseload, you know, things like that. So we do have those comparisons, and we look forward to sharing with that with y'all come session.
Thank you, Mr. Chairman.
Thank you. Next on the list, Chairman Hogg. You're recognized.
Thank you, Chairman. And two guesses what I'm going to talk about.
Yes, sir.
Commissioner, thank you for your friendship. We met each other early on in the process when you first came here, and you and I, as well as the team at the table, have put our lives into the TANF Opportunity Act and the program. This dates back to our 2020 conversations that we were understanding how to better address the fund that had risen to the level that you mentioned previously. And I'm truly amazed at some of the great work that is being done by our pilot organizations throughout the state of Tennessee. I'm not quite as day-to-day into it as I was before, and I'm still not quite sure why. But anyway, I would love to get an update for you on the programs, on the pilots at this moment. And I will state, as part of that legislation that we worked on back in 21, there was also an additional increase in the monthly cash that families got as well, went from $277 to $387. If you could talk about the pilots as well as that monthly amount, and if it's where it needs to be. So thank you.
So, Chairman Hogg, let me begin by saying I want to publicly thank you for all of your help and diligence in getting us to stand up this very innovative approach to human services. You have been a great partner in our in the TANF Advisory Board and the TANF Opportunity Act. So my thanks for that. Okay. So again, just to refresh, we have 7 pilots that are 2 in each of the 3 grand divisions, and then a 7th one that the agency is operating. And those are pilots that are each are very singular in their design. And the objective of each of them is to test a different model for how we would address the issues attendant to vulnerable families with dependent children, and to not only test but to measure the impact of those programs. And just a quick aside, we were able to use, of course, TANF funding for the pilots, the unexpended balance for the pilot, but we were not allowed to use TANF money to actually measure the impact. And I think that that's just ridiculous, that you literally couldn't use the dollars to determine the impact of the program. So we use state dollars in order to do that. And we have seen, as I said in my opening remarks, some of the most innovative work any place in this country on the issues of, again, addressing the presenting needs of vulnerable families with dependent children, and how you can literally grow their capacity to reduce their dependency. And so the legislature graciously allowed us to extend the pilots for a year. It took us a little longer than we anticipated to actually get them to stand up. So we are in the final year of the pilots. They will finish their operations this time next year, okay? And we will receive a final report next December, which will have all of the impact metrics for each of these very 7 distinct pilots. And what you will see in each and every one of them, the participants in these pilots came in need of benefits, goods, and services to be able to make their lives work. And in almost every instance, there has been marked progress in the lives of those individuals with the objective of getting folks to the place where one day they can say, thanks, but no thanks. Because what it is our hope to do is to have a Tennessee where we understand that we will have neighbors that are vulnerable. But we want to have a Tennessee that embraces that vulnerability and grows individuals beyond it. And these TANF pilots are proving that it's absolutely possible.
Chairman Hall.
Thank you, Mr. Chairman. As an aside, and add to some color commentary to what you're talking about, the worry has been that our citizens were reaching this fiscal cliff, that if they bettered themselves through employment, through education, then they would hit a point where potential benefits would go away. We spoke about that a moment ago briefly in the TennCare system.
Right.
But the goal of many of the pilots, and we're seeing some successes, are what we've titled milestone reimbursements or milestone payments, where you have had individuals who have bettered themselves, got that better job, got that education. And then instead of being punished, there is a milestone that goes to help them bridge that fiscal cliff so they can continue on their path to self-sufficiency. And I was going to say something, but I'm going to keep it to myself there, but continue on their path of self-sufficiency. So we have the ability to reduce those numbers of the other public programs that we've got, your TennCare programs, your other programs that you've heard mentioned. So the successes have been great. And I feel like Tennessee is going to set a model for the rest of the country. And the silver lining was we've had the financial resources to do that.
That's right.
And I will make a pitch. I know that as we go throughout the next calendar year for our 7 pilot programs, as this committee considers the dollars and cents, there is an ask that these pilots have had such great staff members and have had great infrastructure created that they would like to see these dollars, maybe even a slightly larger amount of dollars, follow them just to get us through this next year, calendar year. I guess I may be confused, fiscal year and calendar year, but just to continue, if we could find, instead of a $1 million input, maybe a $6 million input. So that'll be my commercial for this committee as we discuss that. And I'm sure the advisory council has heard that. If you could possibly address that briefly, Commissioner.
Sure. So again, remember each of these 7 pilots, they were awarded $25 million over this 3-year period for these models. And now as this period begins to come to an end, we have to wind that work down in order to get back to, if you would, a normal TANF order, if you would. And so in each of these instances, there were significant infrastructure that operated these 7 pilots. And we have, in a wind down plan, we've provided $1 million for each of them to bring these demonstrations to a close. And I think what the issue that Chairman Hawk is raising is that some of the pilots have said we need a little bit more than the $1 million to be able to wind these down effectively. And we are taking these things under advisement. Okay? If I could just follow up on your thought about the fiscal cliff. Please understand that the ridiculous design of our public safety net creates a circumstance where if an individual takes a step forward and has a reduction, has an increase in a resource, then the benefit, literally by design, can be pulled from them. Okay, and so it is not in the economic best interest of folks by design of the system to move forward. And so one of our pilots was designed to test exactly that if you were to smooth out that cliff, make it a gradual slope, that you could guide people, have a glide path to self-sufficiency. This is the kind of innovation that you are doing here in Tennessee that will be a model for the nation.
All right, thank you. Next on the list, Representative Miller, you're recognized.
Thank you, Mr. Chairman, and thank you, Commissioner, and your team. And I want to say I appreciate the statements that Leader Lambert made. He was notably focused on SNAP, right, and what's going on in Washington, which is one location that's out there, and what we can do here. And of course, Tennessee has always prided itself on being number one. We lead, others follow. When there are adversities, we say to the nation, we can overcome it. We can make things happen. We can make things happen, and we can do the right thing. And hopefully we can expedite it, do it fast. We're talking about $145 million per month. That's over 700 recipients of SNAP.
That's accurate.
Is it impossible for us as a state to do anything about making sure that our constituency, all of our constituency, are fed before this deadline, or have access to some type of means to pay vendors to receive food?
I appreciate the question, Representative Miller. As I said in my earlier remarks, the mechanism for distribution of this federal-state partnership is such that the federal government has lines of credit that are accessed when the funds are loaded on the cards. Okay, and so we don't have what we do in Tennessee is we determine eligibility, and then we move that information to a vendor that then manages that distribution mechanism through the cards. Okay, we don't have the ability to recreate that mechanism overnight. Okay, and so it would be impossible in the short term for us to replace that existing distribution mechanism. What we can do is that, Representative Zachary appropriately laid out the FeedTN website, where what has happened is that the volunteer nature of Tennessee has again quickly revealed itself by organizations of faith and other community folks have come together to make these feeding opportunities available in the near term. But there isn't anything that we can do to replace that $145 million federal mechanism. And it's been a federal state partnership forever since its inception. We cannot replace that overnight.
Representative Miller.
Mr. Chairman, so we're not talking about the fact that we can't afford $145 million. Matter of fact, we can afford $240 million, $500 million. That's not the problem. The problem, as you just said, is the mechanism of getting those dollars to the recipients.
That is correct. Yes, sir.
Thank you.
Next on the list, Representative Parkinson.
Thank you, Mr. Chairman. And Commissioner, thank you and your team, and I really love and appreciate your passion for what you're doing. So does our state have $145 million that could offset the SNAP benefits? Or does the department have the revenue to actually, if there was a distribution mechanism, do we have the $145 million to offset the SNAP benefits?
The Department of Human Services does not.
Okay, does the state?
That is one that's above my pay grade.
Okay.
That's it.
Okay. So, okay, thank you for that. With the monies that are allocated under the TANF program, could some of those monies be redirected to offset the $145 million that it would take to get people the benefits that they needed if we had a mechanism to do it?
Representative Parkinson, again, I appreciate the question. We are exploring all possibilities for anything that we could do in the near term to mitigate this pain that has been caused by this shutdown.
So should I take that as a yes? That is a possibility.
It is something that we are reviewing right now to see what the possibility would be.
Let me ask this. Could a possibility, I'm thinking about solutions. So could a possibility be that the department actually makes the purchases of the food for the provisions for those individuals? Is that a possibility?
Okay, so again, I guess there are two ways I go with that. The first is, one, again, the department does not have the resources to do that. But even if we did, then what would the distribution mechanism be? And really the challenge, the challenge here is there is a very efficient existing mechanism to deliver these food benefits. And without that mechanism, it makes this issue very, very difficult.
Yes, sir. Completely understood. The mechanism for distributions of the foods, if the department actually made the purchases, would be the individuals that are recipients of the SNAP benefits actually just going to pick the food up. And so, and with that, I want to ask, is there a possibility that the department could provide letters, official letters, or forms, or either an official letter that would serve as a voucher for the amount of SNAP benefits that the individuals receive, for them to present that letter to the grocers for reimbursement of the amounts of the monies that that individual would have received on their benefits, to come back to the grocers from either the I'm sorry.
Yeah.
I want to make sure that okay.
Please.
So could the department provide a letter, an official letter, maybe distributed through your area DHS offices, to the individuals that would be eligible for these benefits this month, to pick up from that office, use that letter to purchase the needed foods that they may need and pick them up and take them to their homes. And then those letters be brought back to the department by the grocers for whatever type of trade that needs to happen to offset those resources.
So, Representative Parkinson, that again, the challenge in that would be that grocers would have to accept simply a letter of
Yes.
credit. With what they do right now is with the EBT card, they accept payment. So again, I mean, you would have to have grocers that would decide that we would accept this letter of credit. To put a mechanism like that in place, again, it would be a massive and timely undertaking. Truly the easiest way for all of this to get taken care of is for the government to get open to do its job.
And thank you, Commissioner. I truly understand that, but we are not in control of that part of it. But there are some areas, respectfully, some areas that we may be able to control. I remember when there was a massive flood in the Memphis area, and Memphis Light, Gas, and Water needed to know who's would receive some type of assistance from the department. This is before you got there. Assistance from the department to be able to help to offset some of the costs of some of the expenses with the utilities or something to that nature. And we simply got the commissioner. I did this. I pulled the commissioner and the head of Memphis Light, Gas, and Water at that time together, got them on a three-way call. It was that simple. And they were able to work out how they could trade lists securely to ensure that the people were able to get the access that they needed. And so I think that I don't want us to, with all the brilliance that exists here in the state of Tennessee government, I don't want us to overcomplicate what could be a fairly simple matter. And, I also want us to think past the reimbursement from the federal government if we have the means to just take this $145 million hit, which is a small hit to a $56 billion budget. And so there may be, a matter of getting with, the Tennessee grocers and letting that become the portal to be able to communicate with the department and say, hey, if we provide the letters, official letters, and these recipients provide official state ID along with this letter, that you guys allow them to purchase these groceries, and we'll work out the reimbursement on the back end, however we need to work that out. And so I hope that you would just give that some consideration.
Representative Parkinson, again, I appreciate it, and I would be happy to think that through. I would tell you that it isn't near as simple as you laid out. Your scenario is for one jurisdiction.
Yes.
You were talking about doing this for, hundreds of thousands of Tennesseans all across the state.
We are Tennessee, sir.
And
So you said it yourself.
We take it under advisement.
Yes, sir. Thank you. I appreciate it. Thank you, Mr. Chairman.
Yes, sir.
All right, thank you. Next on the list, Chairman Hale. You're recognized.
Thank you, Chairman. When you talk about these programs and pilot programs and being able to move families and improve their lives, I want to give a shout out and Representative Chairman Williams also for Empire Upper Cumberland and the work that's been done there. And Director Farley, matter of fact, texted me earlier and just wanted to get together to talk about the impact that has had for families. And if we can take that and spread that across Tennessee, we were able to get those people that now need those services. Now they've improved their lives, their families' lives, the community's lives. So for that, but then my question moves to something different. So could you Tell me if the department plans to participate in the summer EBT program next year. And then second question to that is, what was the difference between the people that were served and the cost maybe between the summer EBT and the TSNI? So if you can kind of, because that had been some question this summer as I've been out and about.
Representative Hale, thanks for the question. The governor authorized the summer nutrition program where we or appropriated $3 million in order for summer feeding, and we did not do the food and nutrition service summer EBT program. And so of that $3 million, we served 18,000 children this past summer, and spent all but 5% of that $3 million. It would be our intention with similar funding to do the same thing for this upcoming summer. I would highlight that there was, much hue and cry about not starving the children during the summer. And this $3 million was made available. We served 18,000 children, but 5% of those dollars are unspent. And it wasn't because they weren't available. So my argument is, and has been for a long time, we don't need more programs. We don't need more spending. We need to spend what we spend more effectively and efficiently.
Mm-hmm.
We need better systems.
It's good. It's good. Thank you. I appreciate that. Thank you so much. Thank you, Chairman.
All right, thank you. Members, we are getting closer to the noon hour. We've got everybody on the list. You're going to get your opportunity. I'm just going to, again, reiterate the point that keep your questions brief, keep your answers brief as well. Leader Camper, you're recognized.
Thank you, Mr. Chairman. Thank you for your presentation and all the innovation, that you guys are doing within the department. There's an Affirm office in my district.
Yes, ma'am.
And they're doing great work.
They're wonderful.
Yes, they are. They're turning people's lives around and helping fathers. So I really appreciate the things that's happening there. You talked about the impact SNAP is going to have and what we can and can't do. I do think there's some things we can do from a discretionary perspective within your department, within several departments. And I will say I did reach out to the governor about that. Because I think he should, use the power that we have here, regardless of what's happening at the federal level. And I really would like to talk to the issue of bipartisanship because, when you do work in a bipartisan nature, which we've done with you to
Yes, ma'am.
help get things done, and oftentimes at the state level we've done that, and we've committed to that would be something that we would do. But it really takes compromise to get it done. And somehow that is seemingly to turn into like a negative word at the federal level. And it's more about blaming and things like that. So I think that if, Majority Leader Thune would compromise a little bit, maybe use some skill negotiations, some creative thought like you've been doing here, and some political courage, we probably could get to 60. But we haven't, and he hasn't. We want to blame another person for not getting there. So I think in a bipartisan way, we can get there. My question to you is, with respect to, and I get you said the TANF reserves were already obligated.
Yes, ma'am.
But you have the Fresh Meals program. There are other programs that I feel that the department can use through discretionary grants to faith-based organizations, since we're leaning on them. I think the representative gave some good ideas that we can consider, as we work through getting to 60 in Washington. So what are some of the things that you all are doing with respect to servicing SNAP recipients to help usher us through, let's just say the next 30 days?
So, Leader Camper, I appreciate the question, and I would just, well, let me answer the question and not editorialize. We have turned over every stone that is in the resource bag of the Department of Human Services to make available for our consumers. I cannot tell you how amazed and proud I have been of watching my team sit around the table for hours and look through every policy, every regulation, every funding stream. What can you do with that to make these things available? And all that we can do, we have made available through feedtn.org. There's the other feeding source you talked about. Again, it's a federal feeding source. There are several feeding sources of the Food and Nutrition Service, but they are all federal sources that are caught up in this shutdown. And in just a head of an, I guess, editorial comment, you mentioned Leader Thune. There's another name. There's also another leader.
There is.
And when so we're talking about compromise, I
think they need to negotiate.
It takes two to
And
compromise.
it does. I agree with you.
Yes, ma'am.
I absolutely agree with that statement. And that's the point that I was making, because my colleague started with another name, and I wanted to end with this name so that those two names can get together from a bipartisan perspective.
That's right.
And get some stuff done.
Yes, ma'am.
And even call on the vice president to come in and negotiate.
And the
Call
truth.
on Jesus.
That's it. And folks, the truth is, okay, we exist at the get it done level.
Yeah.
Okay. Y'all exist at the making them get it done level. Okay. So we're gonna keep working on getting it done with what we have in the short term, and pray that more reasonable heads prevail someplace, because Tennesseans need it.
They do. Thank you for your comments.
All right, thank you. Chairman Williams, you're recognized.
Thank you, Chairman. Thank you, Commissioner, for being here. I wanted to start by saying, glad to see your health has returned.
Well, thank you.
Lots of folks here and around the state were praying for you, and you and I had an opportunity to hobble together across the convention center a few months ago.
Yes, sir.
Looks like you're doing much better, and thankful for that. You're doing a great job, and so we appreciate your leadership over there.
Thank you so much.
I got to admit, I'm kind of in a weird spot. There's something that I want to talk to you about, but I'm educating myself as I go along. So I wrote down a few questions, and it has to do with the Child Care Development Fund.
Yes, sir.
This body has made significant inroads as it relates to making childcare more accessible to the citizens of the state. It's a huge problem that we have in the state particularly for working families across the state. I know that that child care development fund was reduced about $44 million in the last budget cycle because of the federal funding that was associated with it. And it's my understanding that reduction is in most part because of the conservative fiscal policy here in helping people get employed. As you described earlier, the average household income has increased in the state of Tennessee in the last several years, and the repercussions of that success has been a challenge in this Child Care Development Fund. I was wondering if you have any idea of what the landscape will look like in the coming year as it relates to that, and are you expecting further cuts because of that success in the Child Care Development Fund?
So we are budgeting for a similar funding level. this was a little bit complicated, but because of a decrease in the number of children in Tennessee receiving free and reduced lunch, that then that calculation ended up impacting our Child Care and Development Fund to the tune of $44 million. And this happened in the last quarter of the fiscal year. So we had budgeted and were spending per plan, and then get hit in the last quarter with this $44 million reduction, and had to scramble and reduce already contracted services in order to meet that that $44 million reduction. So we have planned accordingly for this fiscal year.
So in that reduction is what's causing the direct payments or the reimbursements for those childcare facilities. I also think that we also created a waiting list. If you could talk about the waiting list and whether you expect that waiting list to grow and how we might be able to move people from a waiting list to services.
Sure, that wait list is currently 8,000 families. Okay, again, the only way to, I guess, be able to reduce that wait list, of course, would be to be able to increase the resources. And the wait list is for our Smart Steps initiative, and that allows lower income families to access the subsidy that would then serve them to provide much needed child care services. And I would be remiss if I didn't say that between the work of this administration, this legislature, and this department, we have made great strides in increasing access to child care in Tennessee. Great strides. But the need is mighty. And this is a resource that helps ensure that a mother and father can have their child in a safe, healthy, developmentally appropriate place while they then go to work. And so it is a vital resource for Tennessee. We've done a great job, but there's a whole lot more work to do.
Thank you, Commissioner. I will say a lot of discussion about TANF dollars. Obviously, because of this challenge in the wait list, is there a means by which we could use those TANF dollars to kind of offset this to try to get some of the kids off the waiting list, or is that just an impossibility?
So there is a mechanism attached to TANF, which does allow for a transfer of TANF to the Child Care and Development Fund, and that's something that we are it's under review.
Okay. Finally, and this is where it gets really a gray area for me. So if I don't ask the question right, Chairman Hicks will bail me out in his infinite wisdom. But it's one of the things that we found out, and if you spend a little bit of time with the members, you'd realize that some of us come from pretty humble backgrounds of some of our families could have qualified for food stamps, as we call them, years back.
That's right.
And pride, really, of our families really were the reasons why we didn't take that. And so one of the things that I found is, and it could be that this direct certification has been somewhat of a problem as it relates to free and reduced lunch, where prior to schools could help parents fill out forms which would allow their child to qualify without receiving those benefits. So it's the child still wins as it relates to food and free and reduced lunch, but the benefits that come associated with that didn't apply to the family per se. If that I guess my question is does that direct certification requirement now where that information has come from through the federal authorities as it relates to that. Is that impacting? If we could go back to where schools could assist families in their children qualifying, would that cure the problem with free and reduced lunch and the Child Development Fund? Did I ask that right?
Nailed it.
Mr. Chairman, we've not done any analysis on what has impacted that reduction in children accessing a free and reduced lunch. I would say that we want to do as much as possible to ensure that those that are eligible understand benefits, goods, and services that they are eligible for. Okay, but at the same time, we want to balance, that notion of when folks want to. Let me say it this way: no one avails themselves of the system of public supports unless they truly need it. Okay. And so it has to be our job when folks need it to have an efficient, effective system that gets them the benefits they're eligible for, helps them use those benefits to grow beyond. But the idea of, to get back to your question, the idea of direct certification having an impact on reduction in the roles of free and reduced lunch, we have got no data that would correlate that.
Yeah, I think it might be of some benefit for maybe us to reach out to the Department of Education, put you two together, because I think much like the example you gave earlier, where if someone's income limits just increase a small bit,
Right.
they lose those benefits. I think in some instances what's happening is in the Child Care Development Fund that a similar thing is occurring. Of course, the reason why I say the Department of Education is our educators are there to educate, but they also are raising the brightest and best in our state. And they know the family environment's probably better sometimes than somebody's pastor does.
That's right.
About what's going on in that home and their ability to understand the individual needs of those kids are extremely important. And if the school systems are able to, by way of helping families that are on the fringes of qualification or not, be able to qualify, I think both the Child Development Fund and the free and reduced lunch support could return in a better at the levels that we saw before. And I'm hopeful that maybe we can sort that out in the coming months.
And I would just say that we have asked the Food and Nutrition Service to give us the data by which they made this calculation, because that ended up in this reduction of $44 million. Because Tennessee was one of 3 states that were significantly impacted this way. And we don't know of anything we did in Tennessee that would have been different, that would have resulted in this. So it was California, I think Tennessee and Georgia, I think were the 3 states that had this kind of significant reduction. So we actually want to check the federal government's work in this, because we don't understand how they calculated to get this. So that is something that's still under review.
Okay, thank you.
All right, thank you. Next on the list, Representative Love.
Thank you, Mr. Chairman, and thank you, Commissioner, for your presentation. I had a question first about the pilots.
Yes, sir.
How is the pilot in Nashville doing for the TANF pilot?
It is doing amazing. This is the one that is focused specifically on this benefits cliff. Okay. And again, the notion, and Chairman Hawk spoke to this a little bit. The notion there is that in serving the participants, as they reach particular milestones, there are then payments attached to that so that as their income grows and they would be otherwise have reduced benefits, the milestone fills it in.
Okay.
So it's creating that glide path. And this is, I said, these things are going to be literally nationally modeled once this work is done. So it's going wonderful.
Representative Love.
Thank you. Thank you for your explanation that I had experience when I ran a child care facility, 18th Avenue Family Enrichment Center some years back. And one of the challenges I did have is giving raises to employees who were on assistance.
That's right.
They're working, and we wanted to give them raises, and they would say, Mr. Love, I can't take the raise because if I do take the raise, I'll lose some other benefits, and the raise was not going to be enough for them to be able to get other services. So I'm glad that we're looking into that, and I think it's going to be a wonderful idea when it's implemented fully across the state.
And don't you understand how ridiculous that is?
Sure.
Okay. We literally have built a system that traps people. It says you can't move forward. Don't move forward because we're going to penalize you if you do. That's the stupidity of the design of the system that we currently have.
Representative Love.
Thank you. I did want to ask about the prevailing subject of the afternoon, SNAP benefits.
Yes, sir.
But mine is from a different angle. So when I go to the website for Feed Tennessee, type in my county, it takes me to several faith-based institutions that provide all these opportunities.
That's correct.
Here's a question I have. What if I am the pastor of a faith-based institute that's not on this list and I'm not prepared fully for the full arrival of everyone who might have issues, but I want to be able to serve some people? Is there a possibility, to piggyback on my colleague's question, that a letter could be provided to the recipients of SNAP benefits, maybe in the 37208 zip code, that then could present themselves to institutions in that area, and we would know that those particular persons are not having the SNAP benefits given to them, just so that because we want to feed, of course, everybody, but if we want to make sure that for this particular time frame during this crisis, that we could address the issues for these particular folks, right? That they could present, because I don't want to have you give me their address or their name.
We couldn't do that.
I know.
That's
But-
right.
So I'm not asking that.
That's right.
But if they could be given a letter from your office, and then if they can then know that on Tuesday, that Lee Chapel AME Church is going to open their doors, because we're not on the list, right? And we're not trying to get on this list to provide for everybody, but for that select group of folks that we can't provide for, could they get a letter from your office possibly that they could then present to us and we say, you know what, this is the letter from DHS, and you can then get those benefits? Not the benefits, but the food pantry items.
I understand. And Representative Love, we have got all of our energy right now dedicated to how do we maintain services and staff through this period. And we would literally have to turn our energy to developing this completely new mechanism and not managing the moment. Okay. We have got our folks literally around the clock, and this thing is so fluid, trying to manage the moment. If we had to divert, and it would be significant energy, to, again, building a different mechanism, we wouldn't be managing ourselves through the moment. So I think literally the best thing for all of us, and I hate to sound like a one-trick pony here, but really the best thing for everybody is for cooler heads to prevail
Sure.
and this mess to get over.
Okay. Thank you, Commissioner. Thank you, Chairman.
Thank you. Next on the list, Chair Lady Moody.
Good afternoon now, and thank you so much for being here and taking our questions. And I just think about that phrase in the Bible, for such a time as this, that you were chosen to be here and your staff. And thank you for all your hard work on this in these difficult times. But my questioning here will be along the 3-year child care pilot program.
Yes, ma'am.
And so hopefully give you time to brag on some things. But what we were wanting to know about the $45 million total that was established for this, has it all been spent?
So first of all,
Or how much?
First of all, want to thank you so much for your engagement for Tennessee children and making this fund available. And yes, we are in the 3rd year of this important fund, and we have done some really value-added initiatives with the funding. In the first year, we did staff retention grants for nonprofit and Head Start childcare agencies to the tune of $15 million. We also have provided $2 million to Smoky Mountain Boys and Girls Club of the direct appropriation from the General Assembly. And then we've done a new care partnership grants to support expansion of child care capacity and to incentivize employer investments. Total awards so far is about $7.2 million. And so, yes, ma'am, we have spread those investments across the child care landscape. And just a minute to crow about those, the employer engagements. One of the things that we have been able to do in the past 4 years is really engage the employer community in explaining that this is a shared responsibility, that this is not all the job of the government to do, but that if you want to help your labor force, help have the highest quality labor force, you need to join us in this. And we have some wonderful partnerships with employers that have helped increase access to healthy, safe, and affordable childcare. So I just want to thank you for all of your work in helping us address this dramatic problem of childcare in Tennessee.
Yes, thank you so much. Do you have the numbers for how many grants have been distributed through this?
Just a second.
Assistant Commissioner Baggett.
Thank you so much. So we have issued, in addition to the direct appropriation from you all to the Smoky Mountain Boys and Girls Club, we've issued 1, 2, 3, 4, 5, 6 already. 2 are in the pipeline. And then with this year's funding, we will be sharing more soon. Stay tuned.
All right, that's good news. Thank you for that. And so how can you differentiate how many of those grants went to existing child care programs versus establishing new?
So it's called the new care partnership is nonprofit employer workforce partnership. It changed from nonprofit last year thanks to the legislation that you all passed, making it available to any child care agency. So those grants that were created in the past year are all new child cares, and it is a requirement of the grant that of that round of grants that they be partnered with an employer to encourage sustainability. As we know, Representative Love has already mentioned it's expensive to run a childcare business, and so we're trying to encourage long-term sustainability.
Yes.
But it was all new childcare.
All right, that's good. Thank you for that. And can you share any early outcomes you've seen from this program?
Well, there's new childcares located in the community. That'd be my first response. But if I can just speak a little bit, Commissioner's already hit on it. We have encouraged employer partnerships even outside of the new care partnership process. And things that we've seen from employers is low turnover, higher retention, loyalty to the company. There really is a benefit. And it doesn't always have to be the very top line where you build one on site. That's great. We'll help you do that too. But we'll also at DHS with our pre-licensure unit help match you to an existing childcare program that may have some slots available. You just have to reach out to us and we want to help you fit what needs for your employees. It's a huge passion of our department. We stole somebody from ECD to help run this, Dana Glenn. She's wonderful and would love to talk to any of your chambers, your IDBs, your mayors. She'll do a road show. So there's my plug for her. She may be watching and not like this.
Well, we'll just see.
Yeah.
But now, you have to inspect what you expect, right?
Yes.
And so I thank you for reiterating, but adding to that question. How many childcare slots have been created, if you have that number?
An additional 20,000
Wow,
during our last 4 years.
that's great. Great. Do you have any of the 45 million continuing to be used for salaries? Excuse me.
At this point, we have not been using them as grants to salaries. The legislation that you carried offered capital and salary expenses as potential options. And so we are encouraging capital for our grantees.
Thank you for that. And so that took care of my last question. But thank you so much for the great way you're managing this and making those connections to make it sustainable. Thank you.
All right, thank you. I know I've already said this once, but I know everybody, we went way over. We do have 3 more folks on the list. We are going to get to them, but I cannot stress. Ask your question, give your answer, and let's move on, okay? All right, so here we go. Chairman Baum, you're recognized.
Thank you, Chairman Hicks. I'll just ask one question that still has to do with childcare. Your department received some ARPA funding to partner with YMCA and the Boys and Girls Club, clubs across the state. How many new childcare centers were you able to open with those partnerships? And how many childcare slots have you been able to create with those funds?
Thank you for the question. I'll specifically follow up with you on the number of slots created. We did partner with the YMCAs and Boys and Girls Club. There were 3 grant awards there for capital for the YMCAs and for Boys and Girls Club. 3 grants went to the YMCAs and 20 grant awards went to the Boys and Girls Club. So they went to those different facilities.
Okay, thank you.
Thank you. Next on the list, Representative Sparks.
I'll make it quick. I was at a legislative roundtable for nonprofits about 2 weeks ago, and Mary Littleton, Vincent Dixie, Yarbrough, Campbell, a couple other legislators there. They were even talking about doing more or less. I think they kind of see the writing on the wall with cuts in the future. Someone mentioned leveraging our nonprofits and our churches, and shouted Life of Victory, Brenda Bryant. We were talking about doing a little food pantry this week. She's been doing this for years. My buddy Marty Luffman usually steps up and writes a check for her. She was the church that her church burned down about 6 years ago. Not one cross was burned, not one Bible was burned. Everything else was gone, but everything else, Bibles and cross survived. How much, I want to ask about waste, fraud, and abuse. How much was the state ripped off by waste, fraud, and abuse when it comes to SNAP benefits the past few years?
So specifically, there have been a number of individuals whose benefits have been stolen, and we had a mechanism where individuals who had benefits stolen so it was a criminal enterprise. It was actually across the country doing that. And the federal government worked with us in replacing those benefits for a time. But other than that, I would argue that there is no greater degree of fraud, waste, and abuse in the human services system than there is in any other very significant engagement. And we have an Office of Inspector General that its job is to ensure that the integrity of all of the funds that are meant for serving the most vulnerable Tennesseans, that all of those funds are expended as the legislature intended them to be expended. So we work, and we have an annual report that lays out issues of fraud, waste, and abuse that we work to
Yes.
mitigate.
Do we have enough agents and folks looking at that, do you feel?
I'm sorry?
Enough agents, auditors looking into this?
We absolutely do. Yes,
Okay.
sir.
All right. Thank you. Thank you, Chairman.
Thank you, Representative Capley. All right, that's it. That's all the folks we have on the list. Commissioner, thank you so much.
Thanks so much for the opportunity.
being here, and certainly great to see you.
good
And
to see you.
thank you for your staff. Thank you for answering our questions.
Thanks so much.
All right, without objection, we will go back into session. We are in session. That does complete our calendar for today. Do we have any further business coming before the committee? Hearing none and seeing none, without objection, we stand adjourned. We're adjourned.